Hi, I'm Chris Snyder. I'm a pediatric general surgeon at JohnsHopkinsAllChildren'sHospital and also serve as our medical director for our trauma program here. I come from a family of 8 children. I'm the oldest of 8, and my youngest brother was born with a genetic problem called Jacobson syndrome. Interestingly, he actually had surgery here. Just in the course of walking through his medical treatments and figuring out the diagnosis with my parents, I became interested in the field of medicine. I really like pediatric surgery because it allows a lot of variety. There's a lot of different procedures that we do, a lot of different problems that we deal with, and it's also an opportunity to take care of some of the smallest and most vulnerable patients and to really make a difference for a lifetime. One way to describe what a pediatric general surgeon does is that we can do everything except for bones, brains, and congenital hearts. Pretty much anything in the chest or the abdomen, all the trauma surgeries and endocrine surgeries, we would do those. So I served in the Air Force for 4 years active duty as a general surgeon and trauma surgeon. Was deployed a couple times. So dealt with a lot of high-intensity trauma situations in that, and served in other capacities as well. I think my military experience was very valuable. It taught me a lot about teamwork, and it taught me a lot about leadership. Medicine is a team sport, so taking care of patients involves a lot of different teams with different strengths coming together to deal with the problem. But that team needs a leader. It needs to have someone who is in charge, who's accountable for executing the mission, and who can set the vision for everyone. Trauma designation means that we have all the pieces of the puzzle to be able to provide the best possible care to an injured child, and that we're able to execute and deploy those resources in a coordinated fashion, and that we're always ready. We always have to have all these pieces of the puzzle at the ready to go, because by its nature, trauma is unpredictable. We don't know when or where it's gonna strike, and so that is a complex process. It's a costly process of maintaining that readiness, but I think it's definitely worth it to be able to have that resource for the community, so that, you know, if it was my child who was hit by a car, God forbid, or involved in a shooting or something like that, that I'd be confident that if they came here, they would get the very best care.
Rock, paper, scissors, shoot.
The really good days are the days when we see the fruits of our labor. Lots of different pieces of the puzzle, different team members working together to accomplish one mission, when we kind of see things work out the way that we want them to for the family.
Thank you.
Of course.